Welcome to Health Talk. Today we're going to talk about how to quit smoking. This is a timely topic. We have with us Kimberly Charles and Audris Chiang, and we're just going to talk about all this fun stuff about how do we quit.
It's great to be here. So let me ask you a question. How many patients do you see that are usually smoking, current smokers?
We don't see a lot of people who are current smokers, but some who've stopped. And the ones who stopped, they stopped maybe 10 years ago or 5 years ago or 1 year ago. And what happens if you stop smoking, let's say you smoke 1 pack a day for 10 years and you stop 1 year ago, you get pretty much improvement, but you get maximum improvement for like your heart in about 10 years. So it takes a long time to heal, but the healing begins pretty quickly. Also, if you only smoked for 1 year as a college student and you stop and you're young, you're in your 20s, you heal faster than if you quit at age 60 and now you're 61. You still get the benefit. There's still pretty much immediate benefit, but the bigger benefit is a little later.
So I've heard that a lot of organs are affected just because the cigarette smoke gets into the blood. So which organs heal faster, do you know?
You know, I'm not sure about which organs, but I know that what happens is that nicotine being highly addictive and it goes in your bloodstream, it causes the blood vessels to go into spasm, so they change their ability to have flow. So your tiniest arteries get affected, and we do see them as a retina specialist in the eye. If you have been a really big smoker, and you don't have high blood pressure or diabetes, your blood vessels are already abnormal, regardless of your age.
If somebody says that they don't smoke, but you ask them if they smoke and they say no, you know, some people want to hide it because they don't want to get yelled at or whatever, and you see their eye photos, can you tell that they're lying?
Well, I usually say to them, they say, you know, sometimes I see a 40-year-old and they look normal except for their blood vessels because they check off on the form that they have no diabetes, no hypertension, no allergies, no medicines. And I said, your blood vessels, they're a little abnormal. Are you taking a medicine? Sometimes they're taking recreational drugs. Sometimes they're taking some oddball vitamin like that has ephedrine, you know, they're on weight loss. And sometimes they've been a smoker, you can see it. And so there is a change. And sometimes you see it at the optic disc where the blood vessels are most prominent. Did you find in your research which organs are affected sooner?
I believe it's the heart and the lungs because they're the immediate vicinity of where the smoke comes in. And then after that, it gets traveled through the blood. And then it affects like the eyes, like cataracts, which you see a lot of?
I see that a lot because when we do the full exam, if we see everything in terms of the retina, but if we have a cataract, then we can't see in the retina, and then we see that. So if you're a smoker, you will get a cataract sooner, but also as an ophthalmologist, we look at the upper face, and looking at the upper face, if they're a smoker, they will have fine little wrinkles, like even a 20-year-old, little tiny fine little wrinkles, and even in a 50-year-old, you'll see them. And the tiny little wrinkles are different from anybody else's wrinkles. They're very fine, and there are a lot of them all over every part of the face. So it's very interesting.
How do you quit smoking? If you're actually very committed and you know you're done, what is the first step you're supposed to take?
You know, they say that 90% of quitting smoking is you deciding it's it. I'm done. Usually people quit smoking when their doctor says, you're getting a bypass surgery tomorrow. And then the fear of God gets into them. And it's amazing. This happened to my father. They told him he was getting bypass. He was a lifelong 1 pack a day. He quit. He went cold turkey, and it's been 20-odd years. He hasn't smoked. And I think I've seen it also in my patients. That somebody told them they had a heart attack, they had a stent, they go cold turkey because they realize they don't want to die.
Right.
Yeah.
And it's not, so 90%, all the psychologists say that's 90%, 10% is buying the electronic cigarettes,
Does that work?
the patch. They all work because you're substituting something. You know, it's like psychologists also say to make a list of why you like smoking, make a list of why smoking is bad for you. Say let's that list of why you like smoking. It makes you feel relaxed, you feel good, it gives you a high. And on the bad side, my family smells of cigarette smoke. My doctor says I'm getting high blood pressure, diabetes, and I'm going to have a heart attack. But I don't care. I'm going to do it anyway. So then you have to make a list of, you know, when you decide to quit, you say, okay, this is my date of quitting. Let's say today is, you know, January 1st, and I'm going to give myself June 1st, I'm going to quit. So you have to prepare yourself for the next 6 months of this is my deadline. So psychologists say, create that deadline, sign a pact, post it all over your house. This is the day I quit. And I'm sure everyone will be happy because nobody wants their loved one to die or to be surrounded by cigarette smoke and they're coughing.
And then they get the secondhand smoke, right?
Yeah.
Right. And they get lung cancer too if it's secondhand smoke. So even if your husband smokes and you don't smoke, but you had to live it all your life.
And parents really have to think about their kids too and what impact they have on them.
Right. And also if you smoke during pregnancy, it's really bad for the fetus, for the baby. So some mothers quit right before pregnancy and then they resume after.
So does that still affect the children?
Affects the breast milk.
Oh, okay. Yeah.
So they have to resume after they breastfeed.
Okay.
Okay. But it still affects the children because then they're the kid is surrounded by, and then they get a higher rate of allergies.
So does it matter? Do you still get damage if you're an occasional smoker? Let's say one cigarette a weekend, special occasions, versus if you smoke about a couple cigarettes every day?
Oh, kind of like drinking on special occasions. Does that?
Do you still get the same
I don't think the doctors think smoking anytime is good at all because they think the nicotine is addictive and it carries with it carcinogens as you're breathing it in. They think it's carrying in carcinogens. So you're exposing yourself. Certainly that risk is less if you're smoking once a week versus every day, a pack a day. But you're bringing in stuff that's hurting your lung and your heart.
So when people this happened from an experience. I know some people who have been trying to quit smoking and they substitute it instead, like they get the feeling, oh, I want to smoke a cigarette. They chew gum.
That's
Do
common.
they get addicted to chewing gum? Or is it just
regular
me?
gum or nicotine gum?
I think just regular
gum. Okay.
Well, the reason, psychologists say that because in order to stop, you have to change your behavior. So you decided to stop June 1st. Today's January 1st, and June 1st you're going to stop. So then you have to gradually think, well, I feel calmer with cigarette smoking. So you have to find things that make you calmer. And then some people like touching their mouth with a cigarette. They like the oral sensation. They like that habit. So some people eat food. Some people chew gum. Some people have herbal tea. Some people have cinnamon flavored toothpicks.
Yeah, I've heard of that.
Really?
Yeah. And because they suck on the cinnamon. Because they like the sensation of touching their mouth. So you have to break that sensation. So gum chewing is much better than cigarette smoking. And they say herbal tea, chamomile tea, because that has no caffeine, or some sort of tea. Instead of taking your regular cigarette break at work, you brew the tea, you go through the whole rigmarole of boiling the water, microwaving, or whatever you are at work, dipping the tea bag, playing with the tea bag. And then that sort of releases whatever anxiety you have. And that's the same thing as opening the pack of cigarettes, lighting it up, and so it's important to change your behavior by substituting something.
So do you have a lot of patients who actively come to you for advice about
No, they
quitting?
just tell me that they smoke, and I said, you have diabetes and you smoke, and you're going blind, and you really have to stop smoking and fix your diabetes. Because what happens is, if you smoke and your diabetes is out of control, it causes whatever few remaining blood vessels that are not affected by diabetes to be then closed by nicotine, the effects of nicotine. And they have even less blood flow. So they have two reasons to have no blood flow, the diabetes and the nicotine, and they're going to lose vision, more and more vision. And if they fight me, I could laser all day till I'm blue in the face, till the cows come home. But if they're going to poison themselves with chocolate bonbons and cigarette smoke, there's only so much I can do. And we can inject them with anti-VEGF, we can do vitrectomies on them, but they can constantly ignore what we say.
So it's
There's
really
only-
about willpower.
Right, there's
Yeah.
only so much we can do. You know, if you're going to go home and bathe yourself in sugar and drip chocolate into your face, and then surround yourself with cigars and cigarette smoke and chaw nicotine, it's going to be difficult. And then they're going to have a heart attack because what's ever happening in their eye is happening to their heart.
Yeah,
Right.
of course.
So they're going to have a heart attack or a stroke. And they think they always say, Doc, I can go anytime. I paid for my house. My wife's taken care of. I don't care if I die. I said, you might just have a stroke and you'll be in a wheelchair, so you don't really have a choice. So we prefer you to be alive.
And
you know,
well.
rather than
Yeah.
you think you're going to die. Because what if you don't die, but you have a stroke and you're partially disabled in a wheelchair? You'll be very miserable.
That's so sad. So me and Audris were hanging out. We went to the mall, and there was a kiosk with some guys selling the electronic cigarettes.
Oh, right.
Are those a good substitute, or is
Now,
it?
they are not FDA approved.
Oh.
However, they do work because they deliver some amount of nicotine. However, nobody knows how much nicotine is being delivered because that's not regulated.
Right.
But it is not cheap, but anything to get people to stop, because once people are trying to do that, they're on the road of trying to reach that June 1st deadline where I'm
Right.
going to go cold turkey.
And they're working towards
They're
it.
working towards that.
Yeah. So e-cigarettes, when we saw it at the kiosk, it
Yeah.
was about $3 a pack versus the $9 for the cigarettes. So it still seems like a cutback, and yet it seems like smokers or people who are trying to quit might end up just staying on the e-cigarettes. Do you think that they'd ever be able to cut it out?
Again, it's willpower.
Yeah.
Again, it's their family. Their family has to be behind them. If they hang out with all smokers, it's hard. All their friends are smoking. It's very
Peer
hard
pressure.
to be the only one not to smoke. And then if you decide you're going to quit, they say to throw out all the ashtrays, throw out all the little matches or the cigarette lighters, even the beautiful ones that you won at Las Vegas or in France or, you know, Bali or wherever. And you have to throw away all the things, and you have to have all over your house reminders that you signed this pact with yourself that you're going to quit June 1st and that's the deadline. And you have to remind yourself with maybe an index card saying why I want to quit smoking, because I make my children sick, my house smell bad, my child has asthma, they're coughing.
Yeah, right. All the realistic things that are around them to
They have some people
give
carry an
them
index card. They
motivation.
whip it out
Yeah.
every time they.
Little reminder.
Yeah. There's also craving. Once you
Yeah.
stop, people have this intense craving. Apparently, the intense craving only lasts 3 minutes. So psychologist says you only have 3 minutes to get over this.
So
or
you have to
5
get through.
the
So for
3
3
minutes, so it's not
Yeah.
a long time. So that's why they suggest brewing the tea. You know, doing something.
Yeah. with
that-
your hands,
That's
keep you busy.
yeah, that's calming.
right.
So that they can somehow break this habit.
Interesting. How come some people get lung cancer fast versus people who don't even smoke?
They still get they still
secondhand
get
smoking.
lung cancer.
Well, cancer, nobody knows why some people get cancer and why some people don't. But they do know that cigarette smoking is a direct cause. They have pictures of people who don't smoke, their lung at death, and people who do smoke. And the smokers, their lung is brown. It's not even pink. It's all brown.
How fast do you start getting lung damage when you
Pretty
start
soon,
smoking?
like pretty immediate, because it goes in and it makes the little alveoli, the little cells in the lung, like they're contracting. They can't, you're like suffocating them with smoke. They can't function.
And even for secondhand smoke, then, if you're just passing by, walking on the street, maybe every day to work, there's this little area where people smoke. Do you think that will affect?
Well, you have
say it
air
myself.
around you, but if you're surrounded by polluted air, first of all, like in some countries where it's high pollution, or even Los Angeles, a lot of smog, they know that there's a higher risk of cancer all sorts of environmental toxins.
Yeah.
It's carried in the air. So if
Okay.
you're breathing in polluted air, and if you're breathing in secondhand smoke, they're bringing in carcinogens. They're just floating around in the air anyway.
Wow. Does
Yeah.
it matter if cigarettes are light?
Better than heavy, you know. I mean, if you smoke like the Marlboro Man, which is
Yeah.
the heavy-duty macho,
Yeah.
high nicotine, versus Virginia Slims, it's a lower nicotine level. It's better to go start cutting down that way, but it's not. It's still no good.
Yeah.
Of course. Wow. So, kids these days are getting really pressured into smoking. Oh, I want to look cool. I want to fit in.
Yeah.
I want to make new friends. What are we supposed to tell the children?
It's really highly addictive. Nicotine is really addictive, so that's why kids are caught early. However, in America, there's almost no cigarette ads. Have you noticed? There's almost, they banned it. It's almost, so the only kids who are getting these ads are unfortunately in India, China, Latin America, so where there's no ban. And you
Yeah.
know how we have almost banned smoking everywhere?
Yeah.
You can't smoke in a restaurant, airplanes, public buildings. And
Parks.
so it's very
Starbucks.
hard for children to actually get it in America compared to other
Okay.
countries. This is not to say you can't get it,
Right.
you know, pay for a cigarette here and there. But to tell children, it's very hard. How do you stop children from trying out marijuana? How do you stop? It's a drug.
yeah.
It's highly addictive because children are experimenting with alcohol, highly addictive, and children don't know. Some Indian children in India chew tobacco. And they get mouth cancer, tongue cancer very early as age 14.
Wow.
So
Is
there's-
there no restriction then on the chewing the?
There's no restriction on tobacco
India.
advertising in India
Oh, okay.
or in China.
Wow.
So people can buy that. So people, in fact, the Camel cigarette, they have that Camel and they make him into a
like
character called Joe Camel.
Yeah.
He's considered hip to the middle school and adolescent population abroad, and that's where they get that image. Whereas in America, everywhere it says the Surgeon General thinks this is, you know, damaging to your health, will cause lung cancer. So the cigarette companies have been fighting back in America, but they've been losing that battle in the last 10, 15 years. However, they're left alone to flourish all over the rest of the world.
Is chewing tobacco worse?
It's very bad because your tongue has a lot of blood vessels. It goes direct
Oh yeah.
and you get
direct
cancer.
contact.
Really
Wow.
high rate.
So even worse than cigarette smoking then.
You get, well, they can cut out your tongue.
Oh,
You'll still be
okay.
alive. You know, they cut
Yeah,
out, you know, they
yeah.
reconstruct it. So it's better than the lung.
Why do some people get the surgery done right here
Oh,
when they
right.
smoke?
The trachea, they have a trachea because they have cancer of the larynx because the cancer went
Oh, it
into their
travels
throat.
down.
And it didn't go to their lung, but it went here. So they have to cut out the larynx. They have to make a new larynx.
Yeah.
And they have to put a hole there. So that's how they learn to speak like that.
Wow, very sad.
So there's a lot of cancer, very bad cancer with cigarette smoke. I think they have pretty much everywhere on internet you can see pictures of the lung that's normal and a picture of a lung after cigarette smoke. It's
Right.
like brown. It looks like a
Yeah.
coal miner's lung.
Wow. Is chewing tobacco more popular amongst the older population? Because I don't see a lot of
Young
teenagers,
kids doing
young people,
yeah.
20-year-olds chewing tobacco.
It's very big among baseball players. American
right.
baseball players like to chaw. It's called a chaw of tobacco.
Okay.
It's very popular in Georgia, the southeastern America, and Texas, where Sunbelt baseball is part of baseball legend, like all the 1920s
Yeah,
famous
Babe Ruth. Yeah,
Babe Ruth. They
MLM.
all
Yeah.
chewed their tobacco. They would chew it, then spit it out. A chaw. It would be called a chaw of tobacco.
Do they get the same satisfaction as smoking a cigarette?
You get like tobacco juice,
oral?
and people like it.
Okay.
I mean, I've never tried it. I don't do any of this, but you know, it goes immediately. It's
Yeah.
pretty fast because
Okay.
you have so many blood vessels in your tongue. That's why your tongue is so red. It has a lot of blood vessels. Goes immediately in your bloodstream. So it's like a really potent.
Very direct. Okay.
That is
Yeah.
very unfortunate that you get all this tongue cancer.
Cancer.
Damage.
Yeah.
Yeah.
Get it cut out.
Yeah, the dentists see it
Okay.
Yeah.
because they look. That's why when you go to a dentist, they pick up your tongue with the little gauze and move it from side to side because they want to see.
Yeah.
If you're doing that. Do your teeth get any damage?
They get brown.
Okay.
I don't think they get damaged, but what happens is your gums get damaged. You get less oxygen to your gums.
So
then
gum disease.
You get the gum disease. And then
Okay.
eventually if you do that, then your teeth fall out because your gums support your teeth.
Wow. Wow.
So the other things that we tell people to quit smoking, there's like a list, is you periodically rewrite the list of what's good and bad to remind yourself. You get your family and friends to help you write the list, so they also remind you and to that
have
why,
that support. Yeah.
right, and why you should quit smoking. And the most important thing, a lot of people substitute tea. Some people substitute food and they gain weight, and so it's better to do the cinnamon flavored toothpicks.
Oh yeah, and when people quit, it seems like people quitters tend to gain weight a lot more. Does that have to do with because smoking?
No, I think it's because they substitute it with food because they want something to fill the void where they used to smoke.
Yeah.
So it's very hard to quit. It's because nicotine is very addictive.
How common is it for smokers that quit to get relapse?
What's the percentage? I don't really know, but there's
I
a
think
percentage.
that some people have to take up to 8 times to really successfully quit. I don't know if there's a percentage because it really depends on their motivation, personal. Yeah.
Oh, right. There's a lot of people who say, who when they join these quitting, the people who all quit smoking, they have blogs. They say, I quit for 6 months and then I had a cigarette. Am I bad? So it's okay that you quit for 6 months, you had one. You just keep going and do it again and try to keep quitting. So even if you relapse and have one cigarette, you can try again because it's like an endless process.
Yeah, it's something
It's
you have to work on.
Yeah, it's like Alcoholics Anonymous. Like sometimes you have to be totally free, but it takes a long time to reach that point because it's a big addiction.
So out of the tools and methods available to people who are trying to quit, nicotine patches versus something like drugs like bupropion, which one would you suggest, combination or?
It depends on the patient. Some people want a pill.
Oh, okay.
Like some people just believe in a pill. Give me a pill because they think the pill enables them to reach that June 1st deadline of quitting. It's all psychological, you know, because you can take the pill and you'll still smoke, you know. So it's really how strong their motivation is. Some people like the patch. Some people don't like the patch. Some people have hypnosis.
Does that work?
It can work. It can work. Some people believe in acupuncture. They put needles right here on this part of the ear, and they put needles there, and it does work. Some people put little metal stickies, and they press on it. And they
so
all
it's
talk
the
about
same
it.
pressure
It's
point.
called an acupressure point for acupuncturists. So some people talk about that, and it works for them. There was a British medical journal that said people who visualized tennis matches had a higher rate of quitting smoking. Or if they played tennis, we don't know why. That could have been just a fun study. But it's probably because they took up another diversion. Instead of smoking, they actually had to do something.
Right, with their hands constantly running.
Right, that they're no longer.
So if a patient tells you, hey doc, I'm gonna quit smoking cigarettes, but I'm not gonna quit marijuana, what are you supposed to tell them? I mean, it's still affecting your lungs.
They have more issues when they don't quit marijuana too, because then they can become infertile. Their sperm gets messed up, but you know, I usually don't get into drug counseling if they tell me that. I usually say, okay, fine, and go talk to your internist because it's up to them to tell the internist this. Because what happens is that if you're a chronic marijuana smoker, and we have a lot of these patients, we have very high functioning individuals who smoke every day. What happens is that they have slightly decreased biochemical exchanges where these drug receptors are, because their marijuana will still sit in the opiate receptors. So it gives them some sort of high, some sort of need for that. And a lot of these people are engineers who are very, very stressed. They're up 18 hours a day talking to India, China, Philippines, Indonesia. And so they feel stressed, so they have no way to relieve stress, so a lot of them smoke marijuana. And I say, if they don't want to quit, I feel it's none of my business, you know, because this is now drug counseling. I'm an ophthalmologist. I'm really lucky. But stopping smoking is better because we know it's direct to lung cancer. Marijuana is a more insidious problem because if they're infertile, you know, maybe they don't care.
Yeah.
You know, and if they have ADD children, maybe they don't care either. They've, you know, they've have all the studies.
It's not a very immediate concern.
Right. Lung cancer is bad.
Right.
Of course.
Yeah.
Very bad.
And we have marijuana here. For all I know, everyone's taking it, you know, in the backyard. You know, who do I know? This is California. It's very different from the East Coast. But it is a problem because it's a problem in reproduction, in fertility for men and women.
Are people likely to get cancer too, or is it more common with tobacco?
Usually they don't smoke a pack a day of marijuana. So marijuana is, you also get carcinogens because you don't know where it's grown. They do get things, but they're not smoking that volume like in regular cigarettes.
Why do people like to smoke one pack
Oh yeah,
That's 20 cigarettes.
versus, oh, I'm okay
Just
with
a
one
few.
cigarette? Why are people more, I guess what I'm trying to say is,
It's
why are people
addictive.
more addicted than others?
I guess just like finishing this.
Some people have addictive personalities. They talked about it. They said that it's in families, like some people are alcoholics, like uncle was an alcoholic, so if one person was alcoholic, there are going to be addiction issues in the entire family. So if somebody is obese in a family, somebody else was obese or had a addictive personality. Because if you're addicted to food, it's the same thing. You know, food addiction. So we have 1 minute remaining. What's our take-home lesson? What should we tell the studio audience?
Probably
Quit
just
smoking.
yeah, keep trying. Even if it doesn't work the first time, you can keep trying until you succeed.
Right. Have a deadline date. And
Keep
try
little
to-
reminders.
Right. And try herbal tea and try a reminder pasted all over your house and cinnamon flavored toothpicks. Thank you to our home audience for joining us. If you have questions, email us or call us and make a donation to KSAR if you like this show. And we hope to see you again.